So we're going to talk through how to set up a new patient record and input some protocols using otitis externa as an example. So first of all, we click Treatment Records and New Folder to enter new patient details. So we can input an owner ID, patient name, species, breed, age, gender, phototype, and this is whether the patient has pigmented or non-pigmented skin. So doesn't matter about hair colour. If they've got pigmented skin, you click black. If they've got pale skin, you click white. Input the first diagnosis, so OE left ear, for example. And you can input a note in there if you want to. We then click on this play button to access the protocols. So to start a new protocol, click New and select the species, and then we can select our treatment protocols. So if we're treating otitis externa, click Dermatology, and if we wanted to treat an inflamed pinna, for example, use the atopic dermatitis setting here. Select our phototype, leave it on white if we've got pale skin, click black if there's pigmented skin, click OK. And in this case, I want to use it in scan mode. So I want to scan over the inflamed pinna. So I'm going to click S for scan. And I'm going to click over the 50 centimetres squared. And I'm just going to use my fingers to adjust the size of this according to the size of the pathology on our patient. So once I'm happy with that, I press OK. I can then press Start. And once the machine's finished beeping, we're ready to apply the laser therapy. So hold your handset in contact with your patient or hover away if you've got ulcerated skin or contaminated skin, and then press the little button on the handset itself. When the settings are in scan mode, then just gently move the handset over the affected area for the allocated time, and then when the machine turns itself off, the treatment is finished. In this case, I'm just going to press stop so that I can tell you how we would treat the ear canal itself. So I'm just going to go back. And then, depending on the pathology in the ear canal, if we've got ulceration, we can select wound infected. So if we've got an ulcerated ear canal, we'd select wound infected. Again, select the phototype. This time I am going to use it in point mode, and we'd hold the handset a couple of points over the vertical ear canal and any of the horizontal ear canal we can get to. So we probably only need a couple of points. And then we press start. And as we did before, hold the handset in contact with the skin, apply a bit of pressure if the patient will tolerate it, and press the button on the handset to administer the treatment. In point mode, you hold the handset completely still and you wait for the machine to finish that point. So you can see at the bottom of the screen there your progress bar. It is finished the first point, so you move your handset to the second point, press the button again and administer your second point. Perfect, and that is the treatment administered, 2 points per ear. And then the animal was in acute pain. You could always do a second lot of treatment over the ear canal. So we can find pain in the locomotion settings. So if we just click on one of these points, click on pain, select whether it's acute or chronic. Acute if it's a fresh condition, chronic if it's been going on for longer than a week or a couple of weeks. And exactly the same again, point mode, 2 points, press start, and treat over the top of the 2 points along the vertical and as much of the horizontal ear canal as we can. And that's an example of a treatment protocol for otitis externa.